I'm here with my program director, Dr. Tobin.
Hi.
I'd asked you guys on Instagram any questions you guys want me to ask him, and I chose the most liked and most favorited comments. And so I'm gonna go ahead and have Dr. Tobin introduce himself, and then we'll get to the questions.
First thing I want to do is say that a lot of the answers I'm going to give today are definitely my opinion, not the opinions of Touro University, Nevada. I've been a PA for a long time, about 22 years. I started out in the Air Force straight out of high school as a OR tech, urology tech, and I did that for 12 years. I got into the Air Force PA program, and I went through that, and then I finished my time out in the Air Force with my last 5 years doing a lot of weapons research, which really triggered my interest in research and in teaching and those kind of things. And when I was getting out of the Air Force, I had to figure out what I wanted to do. And I went and taught for 6 years in a school just starting out in Arkansas. And then I moved on to a school in Atlanta for 4 years as the program director. And now I've finally found the best place to be here in Las Vegas at Touro, Nevada's PA program. And things have been moving fast since the 2 years that I got here.
And so the first question that was asked was by Allison and Eleanor. They had very similar questions. Thank you guys for submitting those. So what does the admission boards prioritize the most when choosing who to accept? And how can I stand out as a pre-PA? So those kind of go hand in hand. So what do the admissions board look for when looking for students to accept?
We have a couple tiers to our admissions board. The first place you have to get through is meeting the prerequisites. So if you're not meeting the prerequisites, you're just kind of spinning your wheels by applying to the PA program, because we do get a lot of applicants. The next thing is to excel in some area that we actually look at. If you have 20,000 hours in a certain area, we definitely are going to look at what those 20,000 hours are. If you have a high GPA, we looked at your entire package. If you have a high GRE, we definitely look at everything. So we're looking for well-rounded applicants that have the qualities that we're looking for in our program. How can you stand out as a pre-PA? That's a good question. We could make a lot of money if we knew the exact answer, but I think history tells me that looking at the program that you want to apply to, the number one program you want to get into, what's their mission? What do they want to accomplish with their program? Here at Touro, Nevada, our outreach is helping the homeless. So we have a clinic within the Shade Tree, a domestic violence shelter, and we have mobile clinics. And we're going to get a new student-led clinic with volunteers in medicine. So our outreach is all about the homeless, and adding that into your application is obviously something that would help you, something that we look for when we're looking at all the applicants that we get. Look at the one thing you're good at, look at what the program wants to do, and that'll help you stand out.
The mobile health clinic here at Touro was definitely a big deciding factor for me, in the sense that a lot of first-year PA students don't get to get that hands-on experience that we do here. So that's definitely something that was a huge plus.
Today, a lot of people pick their PA school based on their location. Sometimes you need to pick the location of your PA school based on where you want to practice. The opportunities here in South Nevada are endless for PAs. There are so many job opportunities. So if you want to practice in Southern Nevada, this is probably going to the Touro, Nevada PA school is probably the best thing to do. Even if you may be living in California or Arizona or anywhere in the United States, this is a great place to come.
Definitely.
That's my commercial.
And kind of going off Dr. Tobin's response, so he mentioned if you excel in one area, that's something that catches the admissions board's eye. And so a question that was asked by Chris is, does outstanding patient care experience and volunteer experience outweigh an average GPA? And I think he's already answered that. You obviously want to meet the prereqs and have a solid foundation with your academic history. Michaela asks, what healthcare experience do you think is the most valuable for a future PA?
Well, Michaela, I have a lot of faculty who were CNAs at one time, EMTs at one time, medical assistants at one time. So if I was going to pick a group of pre-PA experience jobs, those three would be it. there are obviously other ones that stand out to us. You know, if you were a BSN, if you were a respiratory therapist, if you were a paramedic, those all stand out also as good jobs for pre-PA. Even though here at Toro we don't accept all the hours for your medical scribe, the more and more we have electronic medical records, the more I really enjoy having students who were scribes in the past. They have an in-depth knowledge of documentation, which definitely helps you for the rest of your life.
In regards to patient care, kind of follow-up question by Ivy. Do you prefer an applicant who's worked in one area for a long time and has become very, I guess, an expert in that field? Or do you prefer an applicant who has kind of their hours spread out in different settings, clinical settings?
Obviously, getting a good diversity of patient care is good for you. If you are a scribe someplace, a medical assistant, maybe an EMT, that's a good diversity. Sometimes you can't do that. Like I had mentioned before, if you're a respiratory therapist, you're not going to have a lot of diversity, but you have a lot of medical experience. If you're an RN, it'll be nursing care that will be your medical experience, and you won't have a lot of diversity, but that's really good experience also.
And Alyssa asks, is doing research in undergrad valuable for PA school?
It definitely boosts your application. Doing some kind of research or understanding research is obviously a good thing when you're going into graduate school. It can't be your patient care, but we definitely look at that.
And Virgil asks, other than lateral mobility, when asked why PA, what answers catch your attention from the applicants?
Why PA? Why are you coming to PA school? Obviously, because you want to help people. A bad answer would be, I don't want to go to med school because it takes too long and I want to get through PA school real quick. We all know that is the case, but we are looking for specific people who just want to care for people. When I think about PAs, I think about the doctors back in the early 1900s, you know. They kind of did it all. They had to do everything and they really interacted with their patients. And I think PAs are kind of that group of people. PAs are kind of small. We're getting bigger, 115,000 PAs in the country. So we're always looking for good quality PAs who want to take care of patients.
Kind of going off of that as well, the why PA, it should be personalized to yourself. There's not, you know, one correct answer that an admissions boards like. You know, it's really unique to your own experiences and how all your experiences has shaped your journey to choosing the PA profession. I don't know if I'm saying this correctly. Fabian, she asks, what's being done to educate people who don't know what PAs are so that there can be more trust by patients in their autonomy and level of practice?
There is a lot of people across the country that are working on that, and that's been an issue for a long time. Ever since I was a PA, explaining. It depends where you are. If you're in Atlanta, Georgia, you probably explain less of who you are as a PA than if you're in a rural area in Arkansas where no one would know what a PA is. So it takes a lot of education with every patient. I think the biggest issue with PAs is you start seeing patients and you tell them over and over again that you're a PA, and some PAs, I think, stop explaining it all the time. And so I've ran into a lot of patients where I say, oh, well, you know what a PA is? And they don't know, but they've been seeing a PA for the last 10 years. And they don't realize that they're seeing a PA. I think it's important for every PA out there to be proud that the patient is seeing a PA and definitely put that forward. You're seeing a PA today. Not you're just seeing a PA, you are seeing the PA today.
And to go off of that, to, you know, get more trust by the patients, I think it really just depends on how well you provide care to them. And kind of moving away from the pre-PA questions, Nick asks, what are some things you've learned over the years from working as a PA, specifically things school hasn't taught you?
Probably the biggest thing that school hadn't taught me, was to listen to the rest of your staff and the rest of the people you work with. I know that a lot of hospitals are going to this. It's usually called timeout now. I did not coin that phrase, but it's called timeout, where the head provider, whoever that may be, the physician or the PA, will take a timeout and ask everybody in the room whether anything else needs to be done or whether anyone in the room thought anything else needed to be done. When I was a young PA, I thought, I'm the provider, I shouldn't be listening to my medical assistant, listening to the nurses, listening to all those other people that have great insight of what's going on with your patient. They spend more time with your patient, they interact more with your patient. So when other people on my team discuss an issue, I definitely stop and listen to what they're saying and definitely take in all their thoughts and what their ideas are.
And Non asks, where do you feel PA education is heading, and do you believe we'll eventually move towards a doctorate in the next few years?
Well, that's a loaded question these days. I'm on both sides of the fence on that, so I'm kind of still sitting on the fence. One, we get about 128 credit hours. There are so many doctorates that you can do 60 credit hours and less. So really, when you go to PA school, the credits that you're taking is equivalent to a doctorate. So on that side, I'm like, yeah, why don't we just make PAs doctorates based on all the material that they take in graduate school? The other side of the fence is it'll increase the cost of PA school, which I'm very against. I want to keep the cost low for PAs so that they don't have a lot of debt after school. And what does it get us? You probably wouldn't be called doctorate in the clinic because that would be very confusing with the physicians. It would probably increase your cost. And I'm not sure if it would give us any more abilities or peer, what am I trying to think of, James? Stature, respect, than we already have. I mean, there's a lot of respect for PAs out there. There's a lot of people that love to see their PA, don't mind PAs seeing them, and I don't think a doctorate is going to get us what we need. But on the other hand, if you're going into academia and you are going to be having peers who have the doctorate, a doctorate of physical therapy, a doctorate of OT, that's where I see the value of having a PA who does have some kind of doctorate so that you can compete with them as your peers.
And our final question for the video was actually the most liked comment. It was by Braden. What are your views on the profession rebranding and possibly moving away from the title of physician assistant?
Great question. I know that the AAPA at the last meeting just voted to hire a private firm for $1.5 million or something to see what other title there is. Right now we've kind of gone away from physician assistant because it's very difficult for our patients to understand exactly what a physician assistant is based on that title, and so we're pretty much calling ourselves PA. But according to a lot of state licensures, we have to present ourselves as physician assistant and not PA. I think just shortening our title to PA, everyone will ask, well, what does PA stand for? And then it would be physician assistant. I know that Dr. Stead back in the 60s wanted to call us physician associates, but the AMA kind of pulled back on that because it was so close to the physician associates, which are other physicians collaborating with other physicians. So we kind of got the physician assistant. But since the 60s, our profession has changed so greatly in what we do and what we can do that the title does not fit us at all. So hopefully someone smarter than me can come up with a better title that presents well. I would like a title that has PA so we don't have to completely go through all that. But definitely some kind of title that's going to help out project more what we do.
All right, so that's all the questions we have for today. I just want to say thank you, Dr. Tobin, for being a part of this video. Do you have any, last concluding thoughts or any wisdom you want to share, impart?
Sure. When I started PA school, they didn't know that the PA profession would last. I don't think we have that worry anymore. A lot of people say that we're going to graduate too many PAs and there won't be enough jobs. I guess I'm a little biased being a PA. I think every physician should have attached 2 or 3 PAs, and so we have a lot of room to expand on that. As we go forward, we always got to stay in that team practice, and so staying with a physician or a group and practicing is the best way. Thanks for sitting down and watching us today.
Thank you guys.